So in this video, I'm gonna talk about nasogastric tube, and there are high chances that during your Nclex exam, you will see a lot of question on nasogastric tube. And whenever you guys studying for your Nclex exam, and whenever you see easy topic question, most of you like to skip the easy topic, and your focus is to study the difficult topic like deep vein thrombosis or meningitis or difficult topic, right? Cystic fibrosis. But when you see easy topic, you mostly like to skip it, and you think that we will come back later on to study, and that time never comes. And during your exam, when you see the easy topic questions, now you are confused that what is the answer. So that's why you should never skip the easy topic, and you should get 100% good foundation on easy topic, right? So let's discuss. So during your exam, there are high chances that they are going to ask you how to measure the NG tube. So how you gonna know how to measure the NG tube, right? So there is a easy trick, which is you just have to remember Nclex. You're studying for Nclex, right? And that is the easy trick to know how to measure NG tube. So what is, so you're gonna start with, so Nclex spelling is Nclex, right? You just have to drop C, NC, and L. You just have to drop these two letters, C and L. You just have to remember N C L E X. So CL drop EX, NEX, right? Nexus. What is that meaning? So that meaning is that you take a NG tube, you will measure from N for nose, tip of the nose. From here, you will go to earlobe, and from earlobe, NEX means you're gonna go to Seifert process. So you will see they say stop last thing right here, right? You just go a little bit like few centimeter below on Seifert process in order to make sure that your tube is in the right location. You got it? So as I said, Nclex, Nclex. So NCL, you skip it. NCL, E for ear, X for Seifert process. So that is the first thing. That is a measurement. So during your exam, they're gonna flip flop. They're gonna say start tip of the nose to Seifert to here. That is wrong. You just have to remember tip of the nose to earlobe, and from here to Seifert process. So like this, and then this. That's the first thing, right? And another thing, if they ask you what is the normal tube length, then you are going to choose answer. In adult, it is 22 to 26 inches, which is 55 to 66 centimeter. So remember that in adult, 22 to 26 inches of the tube that is required. So that's the second thing, right? Third thing, when you're inserting the NG tube, you have to tell the patient to chin down, and chin touching towards the chest area like this. And then patient should be on follower position. Then you start inserting the NG tube, right? So you have to mark it from here to here and here. Then you mark it, and that's how you're gonna insert it, right? So that's the next step. Another thing, when you're inserting the NG tube, let's say if patients start gagging or having shortness of breath, what are you gonna do? So you don't have to pull all the tube out. The best thing is wherever you are inserted, wherever you are, just pull little bit out, little bit. You just withdraw and wait for it. Once the patient is stable, and then you start inserting, right? That's our next step. So let's say the tube is in the place, right? So how you gonna confirm the tube placement? So based on your healthcare facility protocols, you have to follow that. If your healthcare facility protocol is says order the chest x-ray to check the confirmation, then you do that. And some facility they use pH paper, right? pH paper. So let's say if my facility, if they want chest x-ray, then I will order chest x-ray to check the placement of NG tube. If the other facility, if they have pH paper to check the placement, so what are you gonna do? You're gonna withdraw a little bit of the aspirate of the NG tube content, which is coming from your stomach, and that content you will put on the pH paper, and then you will measure the number. So when you're checking the pH number, the pH level should be less than 5.5 acidic. If pH level is below 5.5, that's mean the tube is in the right place. And let's say if the pH level is 7.35 or above, that's mean you are not sure if the tube is in the place, because the 7.35 is neutral, right? It's not acidic. So that means there are chances that tube is not in the stomach area but somewhere else. So what are you gonna do in that situation? Then you're gonna ask the doctor to order the radiographic chest x-ray to confirm the tube placement. And the last thing I want to mention that when you're checking the tube placement, we don't do anymore to push air in and listen with the stethoscope their sound, the voice sound. We don't check that placement that way, because that sound, if the tube is in the lungs or any different location, you will still hear that kind of air voice sound. So that is the not correct way to check the placement, but you should check the placement with the x-ray or pH paper. Make sure. Now let's say if the tube is confirmed, so what you gonna do next? The next thing is, before resuming your feeding, you have to aspirate the formula, whatever you have aspirated the residual. Let's say if the residual is like more than 100, then you're gonna hold the feeding. Got it? If the residual is more than 100, then you're gonna hold the feeding, and whatever you aspirate the residual, you have to push it back to the NG tube. So all the content go back to the stomach. What is the reason? Because that residual has a lot of electrolytes. So if you withdraw and throw in the garbage, that means it's gonna disturb their stomach content. So that's why you should always push that back inside their body, right? And if the residual is more than 100, then you don't give their feeding, because the previous whatever they have in their stomach, the previous feeding is not digested well. So that's why you have to recheck after 1 hour to see if that feeding is like less than 10, right? If it's less than 10, then you can resume your feeding. I mean less than 100, then you can resume the feeding. And in hospital care setting, if the NG tube is connected with the suction, so what happen, once you give the medication through NG tube, you have to clamp the NG tube for 30 to 60 minutes. You should not connect it with the suction. You have to restart suction after 30 to 60 minutes, because all the medication can absorb within 30 to 60 minutes. Because if you start suctioning, all your medication is gonna come out. So that's why you have to clamp the NG tube, and you should not start the suction at that time, right? So that's the wrap up of our NG tube topic. It's simple, quick, and you can easily get a lot of point when you see question about NG tube. Good luck.